Good morning, everyone, and welcome to today's webinar on chiropractics and work comp. This is part of the HNI webinar series, where our mission is to drive change through education. First, we're going to go through a couple housekeeping items. We will be posting the slide deck on hni.com after the presentation today. We will have a Q&A at the end of the session, but please feel free to type in your questions at any point. Throughout the presentation, you can do that in the chat window on the bottom of the GoToMeeting console. You can also ask questions via Twitter using the hashtag HNIU or using the handle @HNIRisk. So we want to give a quick thank you as well to all of our sponsors. They are the reason that we are able to put together this webinar today and our whole workshop series throughout the season, and we really value their support and partnership. Today I'm going to be introducing Dr. Mark Gilarovich. He's a medical case manager at Alaris Group, who is a licensed chiropractor. He's a cum laude graduate from the Palmer College of Chiropractic, where he received his chiropractic degree. He practiced as a chiropractor for 8 years prior to becoming a full-time field case manager at the Alaris Group for the past 7 years and remains fully licensed. I am Jody Mathey. I'm the Senior Claims Consultant here at HNI Risk, and I'm going to turn things over now to Dr. Gilarovich.
Hi, everybody. Thank you for joining my webinar today. I'm hoping that after this webinar you can come away with some tools to better understand chiropractors and how they and why they approach patients the way they do, and how to better deal with those chiropractors on difficult work comp claims where they seem to treat and won't ever discharge and get the person back to work and that kind of thing. Just a little bit of background on myself, just so you know who's talking to you today. I did grow up in the Milwaukee area. Went to high school out here at Homestead High School at Mequon. I did my undergraduate studies at UW Milwaukee and MATC North Campus, Milwaukee Area Technical College. 1994, shortly after getting married, I moved down to Davenport, Iowa to go to Palmer College of Chiropractic, where I obtained my graduate degree as a doctor of chiropractic. While I did that, my wife went through a year-long program to become a chiropractic assistant or technologist, and then she worked for one of the professor's off-site clinics for 3.5 years while I finished my graduate degree. That way, when I graduated, she had the insurance industry knowledge, and I felt I was ready to open a practice at that time. And I opened my first practice in 1999 in a suburb of Milwaukee called Germantown. Quickly outgrew the first practice, moved up the road into a larger facility, and in 2005, I decided to sell the practice. I didn't want to be tied to the business aspect of it anymore, wanted to do some different things. For the next 3 years after that, I worked for a couple different chiropractors, and I taught part-time at Moraine Park Technical College in Fond du Lac. I taught for their nursing and healthcare program, anatomy and physiology and microbiology. And then I had the opportunity to join the Alaris Group and become a full-time field case manager. Basically, I go to people's doctor's appointments with them now who are hurt at work and make sure they're getting the right treatment, they're getting the right therapy. I help coordinate return to work and make sure everything runs along smoothly. So I practiced for a total of 8 years in Wisconsin, and now I've been doing this full-time for 7 years, and I do handle a full gamut of cases, not just chiropractic cases. Actually, I usually have just a few of those and mostly medical. But that being said, let's talk about chiropractors. I think the best way to know where someone's coming from is to know where they've been. So I want to give you a little bit of history about how chiropractic started and when it started and what that was all about. So chiropractic started around the turn of the century, around 1895, with a guy named D.D. Palmer. D.D. was what you called a healer back then. He kind of traveled all over the country, learned everything he could about what they knew about anatomy and physiology and how to treat the human body, and he had a real interest in the brain and the spinal cord, basically your central nervous system, what we call it today. Well, D.D.'s office was in downtown Davenport, Iowa, and in his office building there was a deaf janitor named Harvey Lillard. Well, they say D.D. was always in the office early in the morning till late at night, and he became acquaintances with Harvey Lillard. And one day D.D. asked Harvey, you know, Harvey, what happened with your hearing? Were you born deaf? Was it an illness? An accident? Harvey explained to Dee Dee that about 20 years prior, he had been bent over, straining, lifting something really, really heavy, and he heard a pop in his upper back or neck area. And he subsequently lost his hearing. He'd been deaf for 20 years since. And Dee Dee Palmer thought, well, that's really interesting. Do you mind if I examine you? And they say that Dee Dee laid him down on the bench in his office on his stomach and checked his upper back and neck, and he found an area of what he felt like a vertebra out of alignment or out of place. So Dee Dee Palmer lined up on that vertebra, got ready, put a big thrust into the vertebra. Harvey jumped off the table, and he was still deaf as a doorknob. So Dee Dee Palmer thanked him. Harvey asked him, said maybe we'll check you again sometime. Harvey went on his way, and the story says the next morning, Dee Dee Palmer was in his office bright and early, and Harvey Lillard came running in there ecstatic. I mean, just hysterical. Dee Dee had to calm him down, and Harvey explained for the first time in 20 years, he could hear the wagon wheels on the brick roads out front. And Dee Dee Palmer said, oh my God, we have something here. And he continued to treat Harvey, and Harvey regained basically just about all of his hearing. And Dee Dee Palmer opened Palmer College of Chiropractic in 1897. Now, it kind of gives you a couple of things. First of all, chiropractic can be very far-reaching in its results. You just never know what can be affected. And second, we should be happy that the chiropractors aren't running around saying they can cure all the deaf people, because that was obviously a chance in a million. But that's where it all started at that time. So what makes chiropractors so different from medical doctors? What is it about them that their approach is so different? What it is, it's their philosophy. The chiropractic has a very strict philosophy that believes, which we know to be true these days, that the nervous system controls everything in our body, including our immune system. Well, back in 1897, that was a pretty profound thought. Now we know that to be true. Our nervous system does control everything in our body. The chiropractic philosophy says that if you keep the nervous system free of interference, the body can run itself to its peak efficiency, and your immune system should therefore be able to fight off most diseases and most things that come at it. After all, we know germs are everywhere. Sometimes you have that loved one or that person sitting next to you at work who is just coughing and sneezing and all over the place, and you're thinking, oh my God, I'm going to get sick. And for some reason, you don't. You don't get sick. Well, chiropractic says that your nervous system was running at peak efficiency, there was no interference, and therefore your immune system was able to fight off those germs and do what it does. I mean, after all, when you cut yourself and you put a Band-Aid on it, the Band-Aid doesn't heal it, your body heals it. And that's what chiropractic says. So where does this interference to the nervous system come from that causes problems? Well, chiropractic says it comes from something called the subluxation. That is the big word in chiropractic. When you deal with chiropractors, you'll hear about the word subluxation. And all that means is the misalignment of two bones of the spine putting pressure on the exiting nerve. And that's going to disrupt the brain's ability to control whatever is at the other end of that nerve. Think of it like this. If we cut the nerve to your stomach right now, what would happen? Your breakfast wouldn't be going anywhere, and you'd be off to the emergency room, right? Well, chiropractic says, okay, instead of cutting the nerve, what if we put just a little bit of pressure on it over a period of days or months or even years, but eventually that stomach is not going to function normally because it's not getting the proper signals from the central nervous system. That, in a nutshell, is the philosophy of chiropractic, that the subluxation causes a disruption to the brain-body communication, and that's going to affect whatever those nerves control, including your immune system, and lead to decreased immunity. So where does subluxation come from? Well, chiropractic says it comes from three different areas. It comes from the area of trauma. Trauma, that's the world of work comp, right? Someone falls, something bangs into somebody bangs into something else. Something mechanically causes those bones of the spine to misalign. Next is stress or thoughts, and the fact that, when you're stressed out, you're not sleeping good, you're walking around, your shoulders are tightened up, you got your shoulders up to your ears and you don't even know it, your muscles are tight, all that stress on your body has an effect, and that can cause misalignments to the spine or subluxations. And the third area is toxins. Basically the old, you are what you eat. What you put into your body has an effect on your body, and over time it can lead to weakening of the muscles, things being out of shape, and those spine misaligning. However, this third area of toxins is where chiropractors really get separated from the medical doctors, and it's where it causes a lot of problems in the chiropractic field. The real strong philosophical chiropractors believe that all medications are toxins. Because medications have side effects, they feel these side effects eventually will lead to further disruption and subluxations and disease down the road, so they choose not to deal with medication at all. And that's why chiropractors don't prescribe medication. However, middle-of-the-road people like myself know that there's a time and a place for everything. I mean, if we ask doctors across the country, are antibiotics overprescribed? Of course they are, and it'd be hard to find a doctor who doesn't agree with that. However, when you need antibiotics, you need antibiotics. There's a place for everything. And the philosophical doctors in chiropractic, very, very strict philosophical bound doctors, do not believe in using medication and actually don't believe much in using the other parts of the medical field. And that brings us to a big argument within the chiropractic profession, actually. Guys like myself, or people like myself, feel that a doctor is more than just finding a subluxation in a spine. Because to tell you the truth, I could teach any of you listening out there how to find these misalignments using your hands in someone's spine and how to adjust them. But that doesn't give you all the background of knowing what other medical conditions this person has, knowing if they should be adjusted, knowing if you need to refer them to other doctors. And these philosophical bound chiropractors, the only thing they're concerned with is the subluxation, and that's it. So people like me feel that they are more of a technician than they are truly a doctor. And if that's all they're concerned about, they should almost have a kind of separate degree. And this is a large argument in the chiropractic profession. And these are the guys who are going to give you trouble on your work comp cases. They are not going to discharge. They're going to continue to treat and treat and treat. And it's really easy, actually, to identify these types of chiropractors. It really takes a phone call to the chiropractor. All you have to do is ask, so doc, how long do you generally wait before referring out for an MRI? Or do you have medical doctors in the area that you generally work with to refer patients to? If you get an answer like, I don't ever use MRIs, I don't need to, and I don't like working with the medical doctors, I have no one in my area, if you're not an insurance adjuster, hang up and call your insurance adjuster, because you're going to need a record review or an IME down the road if this person isn't willing to work with other professionals to get that person better. They're just going to adhere to this subluxation basis, and they're not going to discharge. We'll talk more about that in a little bit. So summary is terminology you're going to see out there dealing with chiropractors is a subluxation like we talked about. Sometimes it's called the subluxation complex, which technically involves the tissues and other parts of the joint around it as well. Sometimes it's called the vertebral subluxation, which again is the same thing. And then you have the adjustment versus the manipulation. Believe it or not, even that is another argument within the chiropractic profession. The philosophical guys do not like the word manipulation. In fact, they fought Medicare and had the verbiage changed so that only a chiropractor can deliver an adjustment. A medical doctor, DO, physical therapist, they could do a manipulation. There's really no difference. The philosophical chiropractors say their adjustment is specific to a certain vertebra, like they're adjusting T5 or L5, and that's what makes it different. But the truth of the matter is, when you adjust the spine, there's always a couple segments that go along for the ride. So it's just a semantics type of thing, and I never had a patient in 8 years ask me if I was doing an adjustment or a manipulation. They just wanted to get better. It's kind of a shame that those problems are an issue in the chiropractic profession, because to be a chiropractor takes a lot of education. It's 8 years of school, 4 years of undergraduate studies, 4 years of graduate studies. They do everything the medical doctors do in the beginning. They work on cadavers for over a year, the whole deal. There's 4 national boards you have to pass, and there's extensive amount of anatomy and physiology that comes along with that. Where the general medical doctors will branch off into pharmaceuticals, chiropractors actually stay more with anatomy and physiology, and the chiropractor has more training in anatomy than just your average family medical doctor actually does from that standpoint. But unfortunately, a lot of them come out of school and they kind of throw away a lot of this education and become focused only on that philosophy. So before we pick on chiropractors and the things that give us issues, let's talk a little bit about what chiropractic is actually very good for. You know, in the hands of a chiropractor who's willing to limit his care, a musculoskeletal condition just responds phenomenally to chiropractic care. I feel it's the best place for somebody who has just a pure musculoskeletal condition to be. You know, it doesn't take a lot of treatments generally to respond, and they do very well. Another area, for instance, is headaches too, chronic headaches. We'll talk about some other areas. But believe it or not, just this aspect of musculoskeletal conditions is another argument in the chiropractic profession with the philosophical doctors. They say, hey, P.D. Palmer cured a deaf guy. We don't want to be pigeonholed as just neck and back doctors. Well, the truth of the matter is 98–99% of people walking through a chiropractor's door is for a musculoskeletal condition. But that's why you don't see a national advertising campaign for chiropractors like you do with the American Dental Association or the American Medical Association, because there's this argument about them not just being neck and back doctors or musculoskeletal doctors. Excuse me. Does very well with pain, low back pain, sciatica, stiff and sore joints, pain between the shoulder blades. I didn't realize before becoming a case manager, the medical field really hates treating the area of the spine between the shoulder blades, called your thoracic spine. It's difficult for them to get injections in there. Joints are very tight with the rib cage. There's not a lot of motion in that area. Most spinal surgeons don't want to do surgery in that area of the spine. However, it responds very quickly and very easily to chiropractic care for those same reasons. There's not a lot of motion in that part of your spine, and it adjusts very easily and usually responds very well. Chiropractic is also very good for radicular pain, which is pain down the legs or down the arms that's not caused by a large disc herniation. But even in that case, the key is if you have a chiropractor who's willing to limit his treatment, it can be worth a try as compared to spinal surgery. When I was in practice, I had a very obese patient come in one day with an MRI, and she said, they want to do surgery on my low back. Is there anything you can do? I put up the MRI, and I looked at it, and she had a huge disc herniation at L5S1, and I told her, honestly, I don't think I can help you, and you're probably going to have to go back to the surgeon. Well, she begged and pleaded for me to try, and I said, I'll tell you what, I'll give you 3 times a week for 2 weeks. If you're not any better by the end of those 2 weeks, I got to send you back to the surgeon. Well, in her case, at the end of 2 weeks, she was over 50% better. So we continued to treat her for a while, and then she'd stop in here and there for a tune-up, as we called it. And by the time I left practice in 2005, she had still not needed to have spinal surgery. She was still doing very good. But the key was that at the end of 2 weeks, I was willing to send her back. I didn't say, let's keep treating you here for 6 more months and see if you get better. And that is really the key to it. Also, cases where nothing else has worked. A patient or injured worker has been through the gamut, and you know they're not malingering, you know there's a legitimate problem. Sometimes chiropractic can help a lot in those cases. And just incidentally, I get asked a lot about other things such as ear infections, sinus problems, allergies, and the answer is sometimes. You are affecting the nervous system, so sometimes you can get results with those things. But to say that you can help every single person with sinus problems or allergies or ear infections, that's just not true. It can be worth a try for you. You know, it's just a matter of your deductible or a few co-pays. There's no adverse effects to trying it, so that's usually my answer there. So let's move on to practice parameters with chiropractors. And what I mean by that is things like initial and follow-up exams. What should an exam consist of or look like when you see a chiropractor's notes? Honestly, it should look exactly like an orthopedic spinal surgeon's exam. They're both doing the exam for the same reason, and they both have basically the same training at that point. The surgeon's doing the exam to find out if this person is a surgical candidate. The chiropractor is basically doing the same thing. Is this a chiropractic patient, or do I need to refer him on to a surgeon or otherwise? So you should see things like heel and toe walk, you know, sensory testing, orthoneuro tests like straight leg razor, that kind of thing, and it should be documented well. And then let's talk about what a big question is, the frequency of and duration of treatment plans and when do they refer, right? Because an injured worker goes into a chiropractor and sometimes they come back and here they have this treatment plan with 72 visits over the next 8 months. Well, the problem comes from, honestly, the chiropractic colleges. They're teaching a cookie-cutter approach to seeing patients so that everybody walks through the door gets the same thing. 3 times a week for 5 weeks, 2 times a week for 4 weeks, 1 time a week every other week, and we'll see you every month for the rest of your life. And the chiropractors are putting that cookie cutter template onto everyone who walks in, even work comp patients, and that shouldn't be the case. The gold standard is 3 times a week for 2 weeks. At the end of that second week, if there is not a significant change, the referral process should be getting started. Okay? Now, like in my case when I practiced, I had several surgeons, several medical doctors I worked with in the area. So I would get the person an MRI if I was referring to them, because chiropractors can order all the tests a medical doctor can, MRI, CT scans, lab work, all that kind of stuff. I'd get the person an MRI so they're not wasting their first visit to the surgeon. It always took a little time to get them scheduled with the surgeon, of course. So during that time, it is reasonable to continue to treat them. Up to 3 times a week for 4 weeks is the max. That's 12 visits in a month. If that person is not significantly improved, it's time to move on. Chances are chiropractic is not for them, and they need to try something different. However, all of you listening out there, I know you know that is many times not the case, unfortunately, and not what you see. But that is really how it should be. Also, there's many things that the chiropractor does in the beginning as far as your initial billing that can give you clues to the case as well. For the insurance adjusters listening out there, or for the employers, you can ask your insurance adjuster about these things. But just looking at the chiropractic billing can give a chiropractic reviewer a lot of information. The exam codes tell the reviewer, is this person a new patient? Are they an established patient? A lot of times what happens, you have somebody going to a chiropractor, and then they have a work injury. Well, the chiropractor is allowed to start a new file for that work injury. However, when they bill their exam codes, they still have to bill it as an established patient exam. So when you get the chiropractic records and you get the billing, you can tell just by that exam code, there should be some records that aren't included here because this person was an already established patient. Also, the level of the exam code, there's a way you build the exam codes to level of injury, basically. You should never see an exam code that is used in the emergency room for treating a person with multi-area trauma in a chiropractic office. It's just not as extensive an exam. So just by looking at that billing tells me if this chiropractor is on the up and up or if there's already some shady things going on here. So just for you to know, it's very important to look at that when you're looking at records as well. A little bit more about practice parameters, typical charges for modalities, let's say, electric stim, heat, that kind of thing. It should be the same as what the physical therapists in the area are charging. If a physical therapist is charging $40 for electric stim, you shouldn't see it cost $95 from the chiropractor. They're the same exact modality as being done. Also, there's red flags the chiropractor should be looking for when they see a patient the first time that might tell them this is not a chiropractic patient or I shouldn't be working on this person. A history of stroke, uncontrolled high blood pressure, tumors as far as cancer or otherwise can change the game plan pretty extensively, and even age and trauma. A 34-year-old wakes up with a stiff neck in the morning, that person is not going to need x-rays. However, a 67-year-old person misses the last 2 steps on the ladder and takes a hard jar when they fall to the floor, you're going to want to do x-rays in that case because, of course, as we age, our bones get more brittle, etc. So it's very important. My first year in practice, I had a 92-year-old guy walk in my office demanding that I crack his neck. He had a horrible, sharp pain in his neck he was pointing to, and he said he didn't know where it came from. He just demanded that I crack his neck right away. I kept asking him, you must have done something. He kept saying, I can't remember I did anything. And then I finally talked him into letting me do some x-rays to protect him and to protect me. So I did the x-rays. I remember I put them up on my view box in the back, and I thought, oh my God, I wish they would have showed us more of these in college because it was the most degeneration and arthritis I've ever seen on an x-ray. It was unbelievable. And yes, you can see arthritis on the x-ray. It's wear and tear of the joints, and it's very easy to pick up on. But in the middle of his neck, in that mess I saw, I swore I could see a fracture line through one of the vertebrae in that neck. So I went back up to the waiting room. I badgered the poor old guy some more and said, you must have done something in the last few days. Finally, he remembered he was cleaning out his closets, and he was cleaning out his bedroom closet, and up on top was his bowling ball bag with his bowling ball and everything else in it that came falling down and hit him in the top of the head. Needless to say, I sent him right up the road to the emergency room. I never saw him again, so I'm assuming that was a fracture that I did pick up. I sent him right with his x-rays right up the road. And it just shows you that if you don't have a chiropractor, or if you have a chiropractor too anxious to get that business and not do those protocols properly, that could have been a disastrous situation. That being said, let's now talk about what chiropractors are bad at. The specific diagnosis of conditions. And what I mean by that is you have the philosophical bound chiropractors, and again, all they want to diagnose is the subluxation. In fact, they fought to not have the law say that chiropractors have to diagnose and we have to refer out if this is not a chiropractic diagnosis. All they care about is that subluxation. Well, I could find a subluxation, I guarantee, on everybody listening. The way that we sleep, the way we sit, we carry our stress, you're going to have a misalignment in your spine. So if the only basis to see you is a subluxation, I can see you forever. So we're missing the proper diagnosis here, and in a work injury, if that's all I'm going on, well, that's not even work-related at a certain point, that's just life. They can continue to see and treat if that's their only basis. So that's something where there's a lot of room for improvement for a lot of chiropractors. Next thing they're bad at is the management of the different types of cases. And what I mean by that is there's 3 types of cases that walk through the chiropractor's door from an insurance standpoint. There's a conventional insurance. You know, you have Blue Cross Blue Shield or Humana or whatever it is, but it sets up a template. You get 12 visits a year, $500 out of pocket, whatever it is, it's a template that the chiropractor can't go above and beyond. Once they do, then they can convert the person to a cash patient. And this other type of person can walk through the door, someone who just wants to pay cash. Well, there's no third-party payer involved. That's between the patient and the chiropractor. So if that patient wants to pay the chiropractor to come in every week for the rest of their life, that's their business, right? No one else is paying for that. No one's involved. And then there's work comp and personal injury. I put those 2 together because they're very similar. You want to treat the patient, get them back to their baseline or to a plateau, which we know as MMI, maximum medical improvement, as quickly as possible and get them discharged. Once they're discharged, you can turn them into a conventional insurance or cash patient type of patient. But that work comp PI, you want to get them in, get them treated quick, and get them discharged as soon as you can. However, again, this is the fault of the chiropractic colleges, honestly. It's that cookie-cutter approach. They're not teaching the chiropractors how to deal with the different types of insurance that walk through the door and how to deal with those different types of patients, and they treat everybody the same. Here's your 72 visit treatment plan for your work injury, you know? And that's where you run into a lot of problems. As you all know, too, the next area where chiropractors really have the worst time, I think, it's in their documentation. For any of you out there who have seen chiropractic records, you know that most of the time they're absolutely terrible. You ask for records, you get 3 months of treatment and 2 pieces of paper with a bunch of check marks and hash marks, and you can't read the writing, you can't understand it all. How is this related to the work injury? You know, the excuse I get from chiropractors when I talk to them about it is, well, we own a small business. We don't have time to dictate everything. We just don't have time to do all that. And that's not an excuse because it's actually the law, which we're going to talk about. I've told them, you know, a busy work comp practice for a chiropractor is probably 3 to 5% of their practice being work comp. So when I get that answer from a chiropractor, I just shoot back and say, well, then just dictate your work comp and your personal injury. Then you're not going to have a problem getting paid on those, and everyone can read the notes. That's what they should do, but they don't. And what I said about it being the law is that every state has state statutes that govern chiropractic, just like it governs nursing, they govern medical doctors, and there's state statutes that govern chiropractic. And every state's statutes address chiropractic records. In Wisconsin, I'm going to read you Wisconsin Chiro 11.02, paragraph 4. Patient records shall be complete and sufficiently legible to be understandable to healthcare professionals generally familiar with chiropractic practice, procedures, and nomenclature. What that means is if you can't read it, I can't read it either, and you should not be paying for that claim. And when it comes to chiropractic, what I recommend most of the time is a record review because of that. You know, you have the options out there of a record review or an IME, an independent medical evaluation. Well, many times with chiropractic, the issue isn't the patient. A lot of times you have a legitimately injured worker. The problem is the chiropractor keeps treating and treating and treating, and there's no change in care, there's no change in function. Well, 85% of the time, the chiropractor's records are not going to hold up to a record review, and it's going to shut down that chiropractic care, enable you to have the option for that patient to go see another type of medical doctor, like an orthopedic specialist, etc. But the record review is really the way to go with chiropractic. It will also look at all those things I talked about before, like the exam codes, the type of billing that's going on, and that sort of thing. And if the chiropractor's records, if you can't read them, it's going to get denied by that record review, which is also much more affordable and cheaper than getting an IME a lot of times. It takes place in the background, the injured worker doesn't know what's going on, and therefore it's really effective when it comes to chiropractic claims. Also, I feel that if these aren't done more often, chiropractors aren't going to change their bad behavior. If they're getting paid for terrible documentation on all their cases, they're going to keep doing that. If they start getting denied because their records don't stand up to state statute guidelines, they're going to eventually change their practices to have better records, to do better documentation. You know, in Wisconsin, we also have something called Wisconsin treatment parameters. Those were developed to settle necessity of treatment disputes. They say the same thing. They refer back to the statutes that the records have to be legible. And actually, Wisconsin treatment parameters are even stricter than I am. I say you got 3 times a week for 2 weeks, and that's the standard I generally see. The Wisconsin treatment parameters say within 3 to 5 visits, there should be some significant functional improvement or improvement with return to work restrictions. Otherwise, that referral process should start going. So they're at 5 visits. What I generally see in the field is 6. It just kind of makes sense on 2 weeks of visits. But as you can see, you know, there are rules governing all this, and it needs to be reviewed, and that's where the record review is so handy. It addresses all of this and can shut down that chiropractor who just isn't getting nowhere with your injured worker. You know, the problem with work comp and chiropractors is many of them, they just don't understand. You see, what happens as a chiropractor, many of them graduate chiropractic college, and what do? They open up their own little business on a corner somewhere, and they're kind of like an isolated little island. Well, when you graduate as a medical doctor with an MD, you generally join a large practice or large facility, such as an Aurora, a Wheaton, etc. Those places teach the doctors their protocols with dealing with work comp, personal injuries, etc. They have avenues of, you know, protocols already set up of how to handle that kind of thing. The chiropractors don't, and the colleges aren't teaching them much about it. So they don't learn this from anywhere. So just talking to chiropractors, even talking about end-to-healing or MMI, maximum medical improvement, PPD, permanent partial disability, a lot of them just don't even understand that language. The truth is, even a good chiropractor in many cases has no business owning a business because of these issues. So that is the problem you get a lot of times with work comp and chiropractic. The chiropractors, again, like I said, a busy work comp practice, it's only about 3 to 5% of their practice being work comp. So they don't have a lot of experience in it. They're not familiar with the jargon or the language, and it becomes an issue when dealing with the employer and dealing with the insurance company as well on the chiropractic claim. So what can you do about that kind of thing besides the record review? You know, give a call to the chiropractic office. Whether you speak to the chiropractor or his receptionist and you have to leave a message, explain your goals as the employer. One thing right away is let them know if you have light duty. Because what happens so many times? Injured worker comes into a chiropractor, they hurt their low back, off work. The chiropractor never even thinks about calling the employer to see if there's seated office work available. They're just not trained to do that. Right away, it's, oh, well, you can't go back to the construction yard, you're off work. And many times you ask the injured worker, and their answer is, well, no, we don't have light duty, of course, right? Well, as the adjuster or as the employer, as soon as you know they're going to a chiropractor, give a call over, say, hey, just so you know, we have light duty in any manner, or we can accommodate seated work, or we can accommodate partial hours, let the chiropractor's office know so they have an option right away for you. Let them know that you're not going to accept a treatment plan that goes beyond 2 weeks in duration. Because how can the doctor possibly know how the person's going to be doing further than 2 weeks from now? Even 2 weeks is kind of a guesstimate. So let them know that, you're going to expect an updated treatment plan every 2 weeks. That kind of thing. But establish that communication right away. Ask the questions you want to ask. Do you send out for MRIs? How long do you generally wait? Are there medical doctors in the area that you work with? Let them know that, again, you're not going to accept that treatment plan over 2 weeks duration. Ask the chiropractor to address return-to-work restrictions at the end of every week. They're not trained to do that. A medical doctor addresses it every time you go back. But in general, you see the medical doctor maybe every 2 weeks. A lot of times you don't see him again for a month. Well, the chiropractor seeing the patient so often should be addressing those work restrictions at the end of every week and hopefully advancing them a little bit. So let the office know that, doc, we want you to address the work restrictions each week. We can accommodate light duty, and that's what we'll be looking for. And by the way, we'll expect that your records stand up to state statute guidelines. And you will hear silence on the other end of the phone because they don't even expect you to know anything about the state statutes. And I'm telling you, if those records are unreadable and you can't figure them out, you should not be paying for that claim. You got to get that record review. But that's the main question. The chiropractic office just doesn't know to establish this communication with you as an employer or even you as an insurance adjuster. So if you're able to make that first line of contact and get those questions and establish what you're expecting back for them treating your injured worker. Other reasons for over-treatment that you see out there is in chiropractic, the patient enjoys the visits. I know the thought of bones crunching to some of you out there makes you wince, but honestly, it feels very good to get your spine adjusted in most cases. Our endorphins are stored in our joints. You've all heard of endorphins, like the high people get when they go running or exercising. Well, when you adjust the spine, you're releasing endorphins into the system. So the person walks out of the office, they feel great, their range of motion is improved, they're just feeling awesome, and hey, work comp's paying for it. Why would I want it to stop and have to pay my copays? And then you get the chiropractic doctor who's hanging on because the profession is struggling, honestly, with all the issues I talked about here today. And now you have it from both sides. The doctor doesn't want to let go, and the patient wants to keep claiming it's a work injury. Again, I go back to that getting a record review in those cases. But that's why you have a lot of issues with people going back and going back and going back. So what do chiropractors need to do going forward? What they need to do is do what the medical doctors did about 60 years ago. They need to group together and get into larger clinics. It drives me crazy when you see 6 chiropractic offices in a mile and a half. They're all paying for an x-ray machine. They're all paying for receptionists, for phone systems, for computer systems. If they group together, they could save those costs, and they could also evaluate each other better, like the medical doctors do in these large facilities like Aurora, Wheaton, etc. By doing that, they can improve their diagnosis and management of cases, and they would be able to afford doing dictation and those kind of things for records because they'd be saving money instead of each of them having their own little office on that same mile and a half route. They could improve their documentation finally. I thought some of this would already start to happen these days, but it seems to be taking longer and longer. The East Coast seems to be ahead of the time with that. You see a lot of chiropractors more integrated into the medical clinics and the hospitals and that kind of thing. But out here, you still have that lone chiropractor on the corner who really has no training in work comp, and that's what you're dealing with a lot of times with your injured workers. There are many different types of chiropractic techniques, and they have to be taught at an accredited college, and therefore then they're state approved. If you hear of a chiropractor doing something really weird or that really sounds like, kind of voodoo, you can check with the state association. It used to be called the Department of Health and Human Services, I think, and they've changed the name of that department, but you can always check with Madison on what approved techniques are and what this chiropractor is doing. Many times you'll hear things called Palmer package or Gonstead diversified. Thompson is an adjusting technique that uses a table that drops away for the people who hate the sound of that bone cracking. There's Activator that uses an instrument to adjust your spine, again, for people who hate the sound of that bone cracking. And then there's something out there you really got to look out for. It's called the DRX 9000 decompression table. If you see the word decompression anywhere in a chiropractor's notes or advertisements or whatever it is, it's a red flag. These tables are these huge fancy tables that take up half a room. They have lights flashing, TV screens, monitors on them, everything, and all they are is traction. And the chiropractors are selling this for ridiculous amounts of money for treatment. I'm talking 5 to 10 grand for a course of treatment for this chiropractic decompression for a herniated disc. It is nothing more than traction that the physical therapist is charging $75 a visit for up the road. So if you see a DRX 9000 in the notes or you see spinal decompression, that should be a big red flag to you about this chiropractor and about this case. As far as the bones crunching, that's really not bones crunching when you hear that noise. It's gas escaping from the joints, like when you crack your knuckles. That's the sound you get when you adjust the spine or you adjust your neck. Of course, it's more alarming to people sometimes when they hear that come out of their neck. But it's really not the bones crunching at all. Question I get asked a lot, chiropractors cannot treat acute fractures. If there's a fracture somewhere in the spine or even if it's a wrist, chiropractors should not be treating that until it's fully healed. Chiropractors can treat spinal fusion patients once the fusion is totally healed. Either it's got to be a year from surgery or you better get permission from that surgeon first. But once that segment is fused, it's as solid as bone. It's not going to move and the chiropractor can't hurt it. They will work above and below that area. As far as risks with chiropractic, just like anything, there's always a risk. The risks in chiropractic are so low, though, that they pay the lowest malpractice rate of any healthcare professional out there, even dentists, because the reporting of injuries is that low. The most common injury in a chiropractic office is a fractured rib on an elderly person, of course, because of osteoporosis. But that's by far the most common risk factor in a chiropractic office.
Are you ready for questions?
I am ready for questions. Let's do it.
Good. We've gotten a couple questions coming in from our participants today. The first one is, you mentioned that chiropractic colleges teach 72 visit treatment plans. Are you referring to the chiropractic college you attended or others?
I'm referring to all of them, and I use 72 as a reference, but the way they teach is they teach chiropractic as part of a healthy lifestyle, kind of like you would take Pilates or yoga almost, to increase, the flexibility of your body. They teach chiropractic as a means for staying healthy, for improving the immune system. So they teach this ongoing treatment plan from that perspective, not in the world of work comp. Okay, let's get this person back to baseline, or you know what, this is as good as they're going to do. We're done with the work comp right now. So that is a problem with all of the chiropractic colleges overall that I've had experience with.
Okay. A follow-up question to that. You had talked about 3 times a week treatment for 2 weeks. If you have a work comp patient who's treating 1 to 2 times a week over 6 to 12 weeks, is that typically a sign that they're in a maintenance mode or that they're actively treating for an acute issue?
The key is to look at the records, honestly. If it shows no change week after week from 1 to 2 visits a week, and this person still has pain in the same area, well then you know what, they're at a plateau from a chiropractic standpoint, and they should be discharged and referred on if they're still having problems. The acute phase of care is virtually always 3 times a week for that 2 weeks, and if you're seeing significant, like I said, improvement, it should start tapering off, and you should see the work restrictions starting to advance after that point.
Going back to your earlier reference about established patients versus new patients and coding,
right? Do
you know off the top of your head what the established patient and new patient codes are that people could be aware of?
Sure. For example, exam codes are 99201, for example, is a very basic new patient exam. A new patient, very basic established exam is a 99211. So it goes from a 99201 to a 99211 for established visit, and that's how you can tell. Then it goes from 99201 or 211 all the way up to 99205 or 215. That 5 at the end is an emergency room visit for multi-area trauma. Extensive exam with extensive documentation. You should never see a 99204 or 05 come out of a chiropractic office. You should almost never see that because the exam is just not that extensive. You need so much documentation to back it up. If I see an 05 from a chiropractor's office, right away red flags go off to me that this person is trying to get paid as much as possible off of this work comp claim, and you have to start digging deeper and looking for other issues going on there.
You talked a little bit about record reviews, and you've actually suggested multiple situations to use those. So would you recommend that record review be done by another chiropractor or a different specialty?
Absolutely by another chiropractor. I believe it's even part of the statute that it should be a peer review, at least initially by a peer. So I use different services. I use one service out here called Integrity that sets up IMEs for medical doctors and chiropractors, and they also do record reviews. But any of those type of services generally now have a staff of chiropractors on board for doing record reviews for chiropractors.
Okay. Have you ever worked with any chiropractors that have attended specific training? Is there training out there for how to better serve employers or how to work better within the workers' compensation arena? Is there anything provided to chiropractors for that outside of college?
Honestly, there really isn't. I've been asked several times to put something together myself. The training that is out there has more to do with, billing workers' compensation and the laws around workers' compensation, but not what is expected of you as a chiropractor for dealing with the employers, the insurance industry, and so forth. It's really an area that's lacking.
Okay. We've got one more that's just come in. Employers can help the chiro or any medical provider by sending a return-to-work explanation of the company's return-to-work program. I think this is something you touched on a little bit, Mark, that the employer has to initiate the communication with the chiropractic office at the onset of treatment to let the chiropractic office understand what the return-to-work program is and have verbal communication with the office after every visit. I think the verbal communication is probably pretty important with those offices.
Right. Definitely, and if you're a larger company, when I was practicing, there was a couple companies I actually did go to, as you mentioned, that invited me. Honestly, my practice was in Germantown, and I went to the Harley-Davidson plant over there in Menominee Falls. I had a lot of patients from there. And no, that is a great idea. The thing is, you're going to need to reach out to that chiropractor to do that. And, if the possibility for more business for them is there, they'll take you up on it. But again, explain the goals, that you don't expect treatment plans longer than 2 weeks at a time, that you have light-duty work, and that you expect that they get the person discharged in a reasonable amount of time or referred out to somebody who will better treat the patient. But no, that's an excellent point, absolutely.
I have a question.
Sure.
When a chiropractor is treating, what is like a common use of modalities? Like beyond the adjustment or manipulation, how many other modalities typically are going to be used to treat it at one time? Because sometimes you see 3-4 different modalities being used.
Right, and that is a problem because a lot of the modalities are overlapping in what they do. So, you're doing ultrasound and electric stim. They kind of are doing the same thing in many instances. You should really only see 1 or 2 modalities tops at a time. If you're seeing a chiropractor doing 5 or 6 different ones, that's a problem. Also, the gold standard, and this is for medical doctors, physical therapists, everything, is after about 5 weeks of passive care that's using those modalities, they're useless. They're not doing anything anymore. That person should be in an active type of rehab situation at that point. The chiropractor should have given them exercises by now, strengthening, stretching, etc. Because after a couple of weeks of those passive modalities, they're comfortable. Feels great to lay on a hot pack with some electric stim, but it's not doing anything anymore. Even 3-4 weeks is pushing it, but they say 5 weeks that's the limit. You should not see those type of modalities anymore after that. Okay.
Great. Well, we're about 10 minutes left. If anyone else has any other questions, you can just throw them in the chat box on the GoToMeeting, and we can, answer a couple more questions if any come in the next minute or so. Otherwise, we will probably wrap it up. So we'll wait for another minute, see if anything else comes in. One of the other questions that is kind of coming to my mind right now is whether or not there have been any changes to the state statutes for chiropractic here in Wisconsin over the last 10 or 15 years, or if things kind of stayed the same.
Well, one thing that changed majorly, when I graduated in 1999, Wisconsin had its own state board. I mentioned that you had to pass 4 national boards. Well, some of the states also had their own state board. The Wisconsin State Board was known for being a gatekeeper, meaning it had a really high failure rate, so it kept a lot of people out of the state. Well, they did away with the state board, and because of that, for the last few years, we've had a big influx of chiropractors into the state that normally would probably not have passed that board, and that's been a problem. It's kind of come in and out. It got wiped out for a while, and then they brought it back for about 2 years, and then the philosophical group of chiropractors rallied together, and they got the board defeated again. So now we have that same issue. So that's the biggest change as far as statutes that I've seen lately.
Okay. One last question that I'm kind of coming up with as well is, now you've talked about chiropractors referring to medical doctors and having those relationships. Do you also see, conversely, medical doctors referring to chiropractics, that they have a relationship? Yes,
absolutely. And that's kind of how I set up my relationships when I was practicing, is that the surgeons that I worked with, if they had a case they really felt was non-surgical, they'd send the patient to me and say, hey, Mark, why don't you work on this person a couple weeks and see if you can get any results. If not, send them back. So it's kind of like a back and forth.
Okay, so that should not be a red flag then if a medical doctor is referring to a chiropractor prior to doing some.
No, not at all. Not at all.
Okay.
You know, sometimes the medical doctors these days are pretty savvy, especially in the spine area, and they know what patients respond to physical therapy or chiropractic better. And there's a lot of chiropractors who have that relationship with medical doctors, so that's fine.
Great. Well, we want to thank you, Mark, for coming today. I know there's a lot of frustration surrounding chiropractics and chiropractic treatment for workers' compensation, so hopefully everybody's able to take something away from the presentation today. You'll all be receiving a follow-up email with survey, and certainly be honest about if you were able to get something out of the webinar today, and also give us some suggestions for next year. We're looking for HNIU topics for 2015, and so if there's something you are dying to hear about or would like some expansion on a certain topic, throw that into the survey as well, and HNIU would love to plan something around what our attendees are looking forward to in 2015. So we want to thank everybody again for joining, and we hope you have a great holiday season.
Thanks, everyone.